Well, Connecticut's first ever medically enhanced substance abuse recovery house is up and running. And that means people who struggle with addiction and who also have a medical condition can now receive treatment for both at the same time. Fox 61's Tim Latow has the exclusive interview with the people who made it possible.
There are more than 10,000 substance abuse recovery houses across the country, but few offer additional medical treatment to patients, and none did in Connecticut until now.
We've heard from a lot of our partner agencies about the referrals that they have to make over to the program because it really is a universal need.
Stacy Lawton and Ashland Hayes have poured over the blueprints. They lead the Southeastern Council on Alcoholism and Drug Dependence, or SCAD, which operates substance abuse recovery houses and provides resources throughout New London County.
I don't think that it's any secret that this portion of the state experiences an overrepresentation of opioid overdoses, and it's really it's a problem in our community here in southeastern Connecticut, and it's one that we are trying to address at all turns.
According to Connecticut's Department of Public Health, people in the state are more likely to die from a drug overdose than a car crash. Even though there's been an overall decline in deaths statewide, New London County continued to have one of the highest deadly overdose rates in the state in 2024. Since the pandemic, Hayes says there's been a sharp spike of people struggling with substance abuse who also have a chronic medical condition.
This is our new baseline where we're seeing individuals who are just really having some exacerbations or some chronic medical conditions that are just, have gone untreated for so long.
Hayes says conditions like diabetes, hepatitis C, heart conditions, COPD, and autoimmune conditions are just some of the medical ailments that can make sobriety an even greater challenge. The leaders at SCAD realized there was a need for people seeking treatment for substance abuse who also require additional medical care.
Maybe that individual needs a little bit more education in regards to the proper dietary choices that they need to make, or maybe the importance of regularly monitoring their blood glucose levels.
With the help of funding from Connecticut's Department of Mental Health and Addiction Services, SCAD leaders decided to launch Connecticut's first ever recovery house with 24/7 nursing care, and it's one of the first in the nation. It's been named the Shoreline House of Hope, and it's open and ready to help patients from across the state. In a nod to its name, patients with complex medical conditions that may have even prevented them from being accepted to other programs now have a place to turn to that gives them that hope.
And that's really what this program represents, is addressing a gap that had previously existed and to try and give folks every opportunity and every accommodation that they need to be able to find their own pathway to recovery.
The Shoreline House of Hope is hiring across all departments and is a particularly high demand for nurses. In New London, Tim Latow, Fox 61.